Hey guys, Jim Hoffman here from turbomedic.com, and I want to talk about something today that will show up on your exams and, of course, in real life as an EMS professional. You're going to see a lot of soft tissue injuries in EMS almost every day as an EMT or a paramedic, and I want you to think of it in a way that might make sense to you, where soft tissue is basically everything in between your bones and the outside world, your skin, your muscles, and all the stuff that's underneath floating around inside your body. What I want you to realize and I want you to know is things that are going to help you uh, for the exam. And of course, when you're doing your documentation and you're communicating with other healthcare professionals. And that is, there are two main categories. And I'm bringing this up because I remember when I was an EMT and I would hear these categories and these phrases, and I thought I had it down, right? Then I get in front of my exam and I see, what is this phrase? What is that phrase? And I would go blank. So I wanted to make this quick video to try to help other people out there that might think they have it down, but then when they get in front of that exam and they see that multiple choice question, or they see that scenario, that sort of scenario based question, that they can put it together and understand what it is that they're looking for and what it's asking them for. So the two main categories when it comes to soft tissue injuries and how to keep them straight is closed injuries. And this is when the skin is staying together. All right. Think of it as something that hits the body hard, but it doesn't break through, it doesn't get through the skin. And what you'll see with these types of patients is pain. You'll see puffiness or swelling at the area and color changes. So think of it as like somebody getting hit with something, a blunt object of some type, or maybe they fall down, hit their elbow, hit their knee, something like that, and they get that closed soft tissue injury. Now, an open injury, which of course is the opposite of closed, is where the skin gets broken. This is when something's going to actually cut the skin. It pokes. It could be a poke. It doesn't have to be a cut. It could be a stab or a poke, right? It tears through the skin. And now you're seeing all the things I talked about earlier, that stuff that's underneath. Now that you can see, or it's trying to come out. So think of it again like a poke, where it's a knife cut or a slash or laceration with a knife, or broken glass or something like that. Now, words that you're going to see on an exam and words that you'll see often in healthcare and when you're documenting. And I don't want you to let these words trip you up, okay? The one is contusion. Now, pretty much this is a fancy word for a bruise. And this is that blood that can't come out because it's a closed injury, but it's the blood that's leaking underneath the skin, okay? It's not coming out, it's closed, and this is the contusion. Another term you'll see, and I don't want to get you tripped up, is something called ecchymosis. This is that purple, black sort of color that you see with a bruise. So a lot of people get the contusion, ecchymosis confused. A lot of times they go hand in hand. Just know the differences between the two. The third term I want you to know, and remember you'll see this on exams as well, is hematoma. Okay, hematoma. And this is when the blood is pooling up underneath the skin and it's causing a bump. It's making some swelling going on. And sometimes this can be serious, so just keep that in mind as well. So the bottom line when it comes to this soft tissue injuries and knowing the difference between closed and open and some of the key terms is to know the difference between that closed and open and what you're going to see. Know those sort of fancy words, okay? Because you'll see them on a test day, almost guaranteed you're going to end up seeing those. So the one thing I want you to remember, guys, is that every patient you encounter, it's going to tell a story through the injuries that they have. Our jobs, of course, as EMS professionals, is to sort of read that story and to help the patients, okay? So treat those injuries appropriately. So that's it for this video. I'm going to do another one talking about open injuries and the different types of soft tissue injuries you're going to see. I'll do that in another quick video for you. But in the meantime, if you want some more free study hacks, go check out TurboMedic Insider. It's a free resource. It's packed with lots of easy tips and resources to help you crush your goals as an EMS professional. You can grab it, again, totally free. It's over at myturbomedic.com. I'll put a link below in the notes here on YouTube so you can check that out. All right, that's it for me, guys. As always, I am Jim Hoffman from TurboMedic. Stay safe.